You've probably heard someone say, antidepressants saved my life. And maybe someone else say, they ruined it. So, what's the truth? Let's talk about it. I'm Dr. Georgia Brunner. I'm a psychiatrist and psychotherapist based in Switzerland. On this channel, Beyond Psychiatry, I help you understand mental health with science, depth, and heart. Whether you're taking antidepressants, thinking about starting them, or supporting someone who is, this video will give you an honest, clear, and complete picture of what antidepressants do, what they don't do, and what you need to know before taking decisions about them. Here's what we're going to cover today: what antidepressants really are and how they work in the brain, who they are for and when they are not helpful, the truth about side effects and long-term effects, the process of coming off antidepressants, and why withdrawal can be so difficult, how long you should take them, what research really tells us about their effectiveness, the pros and cons of antidepressants, and alternative to antidepressants. This is going to be a deep dive. Whether you're a patient, a loved one, or just curious, this is your full grounded guide. Let's start with the basics. What are antidepressants? Antidepressants are medications that are designed to reduce the symptoms of depression by altering certain chemicals in the brain, mostly neurotransmitters like serotonin, norepinephrine, and dopamine. There are several classes of antidepressants. First, we have SSRIs, selective serotonin reuptake inhibitors, like fluoxetine, sertraline, or escitalopram. These are the most commonly prescribed. There are also SNRIs. These are serotonin and norepinephrine reuptake inhibitors, antidepressants like venlafaxine or duloxetine. You might also heard about tricyclic antidepressants like amitriptyline, which are older and often have more side effects but are still used, especially for some pain syndromes. There are also some other antidepressants which are rarely used today due to dietary restrictions or other risks. And then there are some atypical antidepressants, like, for example, bupropion, which work a little bit different on dopamine. But there is something really important. These medications do not correct a chemical imbalance. That was a theory we used to explain depression simply. But modern science tells us it's more complicated than that. Depression is not just a serotonin problem. Who needs antidepressants? Antidepressants are most helpful for people with moderate to severe depression, especially when there is functional impairment, suicidal thoughts, or when psychotherapy alone hasn't helped. They are also used in other conditions like obsessive compulsive disorder or generalized anxiety, PTSD, premenstrual dysphoric disorder, panic disorder, and chronic pain. But they are not always necessary. For mild depression, lifestyle changes and psychotherapy can be just as effective and sometimes more sustainable in the long run. We also need to be cautious. For example, if someone has undiagnosed bipolar disorder and they receive only an antidepressant, it can actually worsen the symptoms, triggering agitation and hypomania or mood instability. So, accurate diagnosis matters and context matters. Antidepressants can be life-saving, but they're not one size fits all. Let's talk about side effects because every medication has them and antidepressants are no exception. In the first 1 to 2 weeks, people often experience nausea, headaches, insomnia, fatigue, or increased anxiety. These are symptoms often improve over time, but some side effects can persist longer, like sexual dysfunction, weight gain, emotional numbing. There are also rare but serious side effects like serotonin syndrome or increased bleeding risk or also a low sodium in older adults especially. So it's really important to have a good follow-up in the first 4 to 6 weeks, especially if there are also other conditions. Now, what do we know about long-term effects? Here's the honest answer: not enough. Most clinical trials for antidepressants last only 6 to 12 weeks. That's how the drugs get approved. But many people take them for years, even decades, and we have very limited long-term data. Some people report long-term emotional blunting or a feeling of being disconnected from emotions, even after stopping them. We also know that long-term use may alter brain neuroplasticity. Whether that's good or bad depends on the person and the context. And importantly, some people develop what looks like dependence, not addiction, but a physical adaptation where stopping causes significant symptoms. So we need more independent research and more honesty in the conversation. Let's talk about withdrawal, or what is often called discontinuation syndrome. This is one of the most misunderstood aspects of antidepressants. Many people are told it's easy to stop, just taper over 2 weeks. But in real life, withdrawal can be intense. Common symptoms include brain zaps, dizziness, irritability, anxiety, insomnia. This can last for days, weeks, sometimes even months, especially with medications like paroxetine or even venlafaxine. But I also had 2 cases with escitalopram. It doesn't mean you're addicted. It means your nervous system adapted and now it needs time to readjust. The key is go slow, taper gradually, sometimes over months, and always with support. So how long should you stay on an antidepressant? If it's your first episode of major depression and you respond well, the general recommendation is to stay on the medication for 6 to 12 months after full remission. If it's your second or third episode, you might need some longer time. The most important part is individual assessment. There is no universal timeline. Let's look at the research. A 2008 study showed that for mild to moderate depression, the difference between antidepressants and placebo was small. In some cases, up to 80% of the improvement could be due to placebo. But other studies, like one in 2018, confirmed that antidepressants are more effective than placebo, especially in severe depression. So yes, antidepressants can help, but they're not miracle drugs and they're not enough on their own. Let's weigh the pros and cons of antidepressants. So they can reduce symptoms of depression and anxiety, especially in moderate to severe cases. They may prevent suicide in high-risk individuals. They are easy to access and widely prescribed. They can be used alongside therapy and other treatments. The cons: there are, of course, side effects which can affect quality of life, risk of emotional numbing or feeling disconnected, withdrawal symptoms if stopped too quickly, limited long-term data. They don't address root cause like trauma, lifestyle, or social issues. So while antidepressants are a powerful tool, they're not the full answer and should never be the only answer. Let's talk about alternatives. What can you do besides or before medication? Here are several options that are supported by research. For example, psychotherapy, especially CBT, psychodynamic therapy or EMDR, or trauma-informed approaches. Exercises like regular exercise can be as effective as antidepressants for mild to moderate depression. Nutrition and supplements. You should check your vitamins and your micronutrients, magnesium, B complex, vitamin D, omega-3 fatty acids, and iron. Especially if there is a deficiency, then there is very important to supplement. Mind-body therapies, mindfulness, yoga, breath work, also the regular routines, very important, like sleep hygiene, especially for seasonal depression. Also, go in the sun, get enough light. Nature and connection, time in green spaces, and healthy relationships. This can improve mood. These approaches often work best in combination, and in many cases, they can reduce or prevent the need for medication. One of the biggest myths in psychiatry is that antidepressants are the only biological intervention. But your biology is shaped by how you live, how you sleep, how you eat, how much sun you get, whether you move your body, whether you have safe, stable relationships. What if you try antidepressants and they don't work? First, check the diagnosis. Is it really depression or is it something else? Maybe something trauma related. Second, look at the context. Is there unresolved trauma, chronic stress, neuroinflammation, sleep problems? Third, sometimes medication help only once other pieces are in place, like psychotherapy, nervous system regulation, or social support. Treatment resistance is real, but often it's not resistant, it's maybe a misalignment. Before we go on, I want to take a moment to answer some of the most common questions I get from patients. These are important practical things that don't always get addressed in scientific overviews. So let's go through them quickly and clearly. How long will it take for my antidepressant to work? Great question and a common one. Most people notice small changes within 1 to 2 weeks, like improved sleep or appetite, but the full antidepressant effect, especially on mood and energy, can take 4 to 6 weeks, sometimes even longer. If there is no improvement by week 6, your doctor may adjust the dose or switch medication. If I feel better, can I stop taking it? This is something I hear a lot. Feeling better is a good sign, but it doesn't mean the brain has fully stabilized. If you stop too early, symptoms may return. The general guideline is to continue for at least 6 months after full recovery and taper slowly, always under professional supervision. Will antidepressants eliminate my depression completely? Antidepressants can significantly reduce symptoms of moderate to severe depression and often help patients to function better, but they do not completely erase the symptoms. It's always a combination of lifestyle changes, psychotherapy, and other things that may be needed to be able to eliminate the symptoms, and it always needs time. Are antidepressants addictive? Antidepressants are not addictive. They don't produce euphoria or cravings, but they do have like a physical dependence where stopping too quickly can cause discontinuation, like withdrawal symptoms, like dizziness, insomnia, irritability, or brain zaps. How do I know which antidepressant is right for me? There is no one size fits all. Guidance is based on your specific symptoms, past responses in your family, potential side effects, other health conditions, or other medications you might take, your goals and your priorities. If you have other questions, drop them in the comments. I read every single one and will try to answer them in future videos or updates. Antidepressants can help. They can reduce suffering. They can give you a lifeline, but they are not magic. They don't cure the cause. They don't replace therapy, nutrition, safety, or meaning. They work best when they are part of a bigger plan. If you choose to take them, be informed. If you choose not to, be supported. And whatever you choose, remember healing is possible. Medication can be a ladder, but you still have to climb. Healing isn't just about chemicals, it's about connection, safety, and the story you tell yourself. If this helped you understand antidepressants in a deeper, more human way, please like this video, leave a comment, or subscribe to Beyond Psychiatry. We talk about the science, the soul, and everything in between. See you in the next video.